First of all, thank you to UNICEF DEF for this opportunity to present the case study. And I'll get on with the M Diabetes program. Before I go into that, a quick introduction about Arogya World. Our mission is to change the course of chronic disease. We do work globally, but in India, as I've shown in the star, we do hope to change behavior in 3 to 5 years and convert people, about 50,000 people, to a healthy lifestyle. It's not done just by mobile phones alone. It's a huge task, and we do have several other interventions in place in schools, in workplaces, and in the community. Okay? But for today, I'll be focusing on M Diabetes, using the platform that I'm going to be talking about now. Okay? But why do you think that this is possible, and why diabetes? It's going to be an alarming public crisis by the time the 20 and above age group age over 20 years, and where will we be in about another 20 years? This will be the biggest challenge for India in a growing prevalent population, diabetic population. And there's enough evidence from WHO, and if you look at the DPP, the Diabetes Prevention Program trials, where we've clearly shown that 80% of type 2 diabetes can be prevented by healthy exercise, healthy eating habits, diet, and exercise. Okay? So that's the rationale behind trying to impact social, behavior change in a largely growing diabetic population. And how do we want to do it? I want to bring to you our flagship program, M Diabetes. In this, of course, we have Nokia as our partner, a key partner, and has worked tirelessly with us to make this happen. I'll get into the program details, but critical to our success was the behavior change task force that we set up with people, medical and non-medical people from across the globe, who helped us understand not just diabetes, but stages of behavior change and what have you, so that we create content that is relevant for the country. And we, of course, have our sponsoring partners as well on the slide. Okay? But going on to Nokia, and how this strong public-private partnership has really worked for us. Really want to acknowledge Nokia and the strengths they bring to the table. We have with us Nikhil and Natesh from Nokia as well. Any technology-related questions, Nikhil, who is heading up the Nokia Live platform itself, will surely take. What I want to tell you is that this could not have happened if both teams did not bring their expertise to the table. Of course, we brought the content expertise and the evaluation expertise and everything to the table. But Nokia's Live platform, the Nokia Live platform, which is so easy to use for everybody, that's what was, it really was key, and them working tirelessly with us to make it happen. I really appreciate their involvement and really making it and pushing the program through. So how is it so easy? I don't know if everybody has seen it, because it does come only on the Nokia mobiles, which are S32 or S35 models and above, and not in the higher end models. But this is a model that's easily available, and it's within price range for the common user to use. Okay, so it's a very easy graphic user interface. It's a click point, and then you can opt in. So the people who are getting the subscription and the content on diabetes are the people who have subscribed to this service itself. And more importantly, it's not just in English, but it is in 11 other Indian languages, including English. So people across India, pan-India, can choose from whatever language they want, and they can opt for it. Okay? So how are we using this for behavior change? Just quickly, I'm not going to go into a lot of it. The objective was to provide content to 1 million consumers. It was created, the content itself was created by experts from across the globe and adapted for India, and being disseminated via Nokia Live. The final thing, the most important thing, obviously, is measuring behavior change and how we have an impact on society. Is not directly asking the question of has it had an impact, but really scoring on lifestyle changes, exercise, and eating habits. This is an ongoing evaluation, and I'll show you some preliminary information, but we're not there yet. I will share with you the methodology and how we plan to do it. Okay. What was the content about when we developed it? Broadly speaking, in 4 different categories: medical science, lifestyle, fitness, and diet. And These four, there were several messages and the content was developed with a rationale of sending not just everything on medical science and things, but with a very systematic manner. So every person was getting twice a week content related to diabetes on one of the, on different aspects of diabetes. How did we make this compelling? We did develop it based on not just the diabetic, not just the disease of diabetes and the burden of it in India, but also based on, we worked with Emory University in the US. They had a good understanding of the trans-theoretical model of behavior change, and we put in content which focused on all the changes, all the stages of change, where you contemplate, people intend to change, and then they keep moving from one to, and some people cycle through and come back. So it was important to understand how behavior change, is not just in a controlled environment, but in different situations in different countries and everything. And then, of course, we focused on 5 content areas that I already showed you about. Now, we just didn't leave it at that, because this is a university based in the US. So we took it back to our behavior change task force, which took people from both from India, US, UK, everywhere, so that we did have a solid thinking background on, is this the right thing? Is this relevant for us? Is it technically correct? And what are we talking about out here? And then we did some real life testing with a bunch of people in 2 or 3 different languages, 2 different, and English, of course, and sort of to understand face to face as well if people felt that they were they being offended by it, or is the tone of the message right, or the content, is it appealing to them or not, or is it making sense to them or not. So with that, we did change the tone of the messages, and we made it more actionable, and from what we learned from the testing. And then we took it to real life. Once we started the program, we also went back to the consumers to make sure that in the real life situation, what is happening in the field, are they understanding the messages? Is the public really understanding, getting it? And also, are they willing to share? Is it too difficult, or is it easy to understand? And are they willing to share the information? So what happened here was, yesterday I think we spoke a lot about case studies and pilots, and I just wanted to go back to that point to say that this is why we did this real-time thing, because oftentimes we do a controlled environment, a simulated environment, and then we lose out on it when we really go into the real world, and we're not able to really evaluate what happened to all this information that we're sending out there. So a quick look at how we refined the messages. I mean, most people found it useful. It was easy to understand. The tone was right, and they were, it was really nice to see that they were willing to share this information. So we sort of clustered the messages and understood, and then we continued. There wasn't a lot of change that we had to make in the next phase of testing that we did. And then we continued, Nokia continued to roll out the program to the 1 million consumers. So where are we right now? Quickly on the project milestones. I'm not going to get into all of the details in there, but we did make a commitment to the Clinton Global Initiative that we would reach 1 million consumers, and we created the content with Emory University and other behavior change task force partners. We confirmed it, we rolled it out, Nokia rolled it out to 1 million consumers, and we also got approval from the Ethics Review Committee in India to study and evaluate a subset of these consumers to show if we have impacted behavior change or not. So where are we right now? We are in the process of evaluating. We're looking at analyzing and publishing the information once we finish the evaluation phase. And we're also looking to scale up the service with Nokia to reach 10 million as a target. And hopefully we're also expanding our collaborations with WHO to see how we can partner with them as well, to see how we can impact social change. So why are we on the right track? It is early, but we do feel confident that because we've developed a methodology and process that is strong, that is scientific, and that's robust, we do feel that we are on the right track. And I will just quickly, 30 seconds on the study design and implementation that's in progress. I already told you that we got approval from CCDC, that's an independent ethics review committee, on the protocol itself. the evaluation takes, there are two phases to the evaluation. Most often we say, okay, we said, what are you thinking about, and what did you, after you get all of this, what are you doing? But it's not just that. So we had a two-phase evaluation process. One, the pre-phase, where we're looking at these groups of people who are Nokia Life subscribers and who will be getting content. We did that first to collect the baseline information. At the same time, we also looked at a control group population who were not Nokia Life users, but just any random mobile users who will not be getting content on diabetes. So that was, there's a control population and an experimental group just to establish baseline on behavior, on their knowledge of diabetes, their intent to change, and what are they eating, what are they doing, what are they exercising. So that was that. And then after 6 months, we are going to reevaluate with the same groups of people. What are they doing now? Have they changed? The same questionnaire, so we'll know what is going on with that. Okay? So that's that. So where are we now? We are happy to report that we did have we of course reached 1 million consumers, but we also want to say that we had a very low opt-out rate. People are engaged in the program, and we did get very positive consumer testimonials. It is anecdotal at this point, but we do feel that it's heartening to see positive reactions on the content that we're delivering. So with that, I think he's ready to close me up. So I really want to thank you for listening, and of course we're committed to making an impact and a social change in this sphere of diabetes, and really thank Nokia also for being there with us. Okay.
Not closed yet, but allow for questions for clarification.
Standing up there, waving his mic.
Any questions from the audience? I have one otherwise. What are some sample possible metrics you could look at? What are some possible sample metrics you could look at? How people change food by X number of calories, that kind of stuff?
No, not calories, but since we're asking the common person, asking about calories will be very difficult. So food, and specifically roti, sabji, are you taking fresh vegetables? Are you taking fruits, 1 serving, 2 servings? Are you walking up the stairs, coming down? Very real life, very commonly thought of things, bhaji bonda for the South Indians, samosa, chaat, whatever for the North Indians. So we're trying to tailor it. Are you happy, if you go to the shop, do you ask for a Coke, or are you okay with drinking water? So very, very systematic, things which are real, and then we will analyze in the back end between stated behavior and derived behavior and see what is really happening.
Subscription cost?
Right now it's free. There's Nokia. You want to answer?
Any more questions? Yeah.
I can't use this on my BlackBerry, right? And
no.
And my workers would have different phones. So if you want to probably replicate this, like a health phone, if I understand, you can't make calls through it, can we?
Sorry, I cannot hear you.
I mean, what I'm asking is that right now you've tied up with Nokia, and so you need to have a Nokia phone, and you need to do it like that. So is there any other way of
Nokia will answer for you. Can you speak to the mic?
Good question. So this is available across about 50 odd phones of Nokia now, starting at about 900 rupees to going up to about 6,000 rupees.
Right. If Nokia, if we move to some other subscriber or something, yes, then we will have to think of other possibilities. It is a Nokia Arogya. Right now, this program is Nokia Arogya, for sure.
So in terms of interactivity also, we could publish a number along the message and it just clicks on it and the call terminates out. So the elements of interactivity do exist.
And I think Nokia's subscription base is, pretty huge. So there are, I think we've reached 1 million, and hopefully we will reach the next milestone as well. The cost of the phones will dictate. I mean, it's the Sec Bs and it's not the Sec A for sure. It's Sec B and below.
Last question. Yes.
You're tied up with the international agencies, university, and also Center for Chronic Disease, etc., while perceiving the project. Why that vendor locking situation? See, when we do a project, that too of use to entire population, the vendor locking situation has to be avoided. Why that component has not been thought about at the time of conceptualization of the project?
Vendor lock-in. Can you move beyond vendor lock-in, which is only Nokia? I think that's a question you can ask for Nokia afterwards. Yes, maybe you can jump in here.
Maybe we can parking lot this and take it up. Yeah, that's the next phase. Yeah.
Business, so they're adding value to their products.
Yes.
But independent NGOs, when they do something, why they enter into a vendor locking situation? Why don't they conceptualize that at the time of conceptualizing the project and also consulting so many agencies?
It's, let me take that. It's not exactly a vendor lock-in. I think the project was conceptualized. Nokia also wanted to do something around social and related aspects pertaining to healthcare, and Arogya also came on board. The task was more of scale. So all of us have heard through pilots. How do you scale it up? So Nokia Life already has about 70 million odd subscribers who subscribe to the service, and that provides a platform for immediate scale. So if you are talking about 1 million getting reached in about a year, that's a significant achievement already, and moving up to 10 million. But having said that, yes, over a period of time, this has to be device neutral as we speak.
Yeah.
But at least you have made an impact for the 1 million, 10 million now. And the biggest aspect, which obviously Sandhya didn't share, is that there is a 1 into 15 virality out here.
Correct.
Someone who's receiving the message is actually sharing it to 15 others. So look at the impact. It's about 1 to 15 million now.
Okay.
Yeah, the very fact